Hi, my name is Ajay Kirtane. I'm a professor of medicine at Columbia University Medical Center in New York, and I'm here to present the results of the 6-month data from the RADIANCE-HTN TRIO study, which I presented at TCT. RADIANCE-HTN was 2 parts of an overall program of studies. The first was a RADIANCE-HTN SOLO study, which took patients off medicines and then tried to compare renal denervation versus a sham procedure. RADIANCE-HTN TRIO, which is what I presented, was an on-med study, or taking patients on one single combination pill of 3 medications and then randomizing patients to renal denervation versus a sham control. In order to be eligible for this study, patients had to have elevated blood pressures despite multiple medications. In average, in this study, patients had blood pressures of 160 despite being on 4 medications at baseline. They then were taken off their home regimen, put on a combination pill consisting of a calcium channel blocker, thiazide diuretic, and an angiotensin receptor blocker. And if they still had elevated blood pressures, they then underwent anatomic screening and then randomization to renal denervation versus a sham control. They then were followed for 2 months, at which the primary endpoint was ascertained, which was a reduction in blood pressure, renal denervation versus sham. We published that data earlier this year in the Lancet, demonstrating that renal denervation decreased blood pressure to a greater extent than the sham control. And the data I presented at TCT looked at these patients from 2 to 6 months as medications were added back to try to see if blood pressure could be further lowered and we could achieve better rates of control. What we found is that there were less medications that needed to be added back in the renal denervation group compared to the sham control. Why is that? Well, I think that if you think about the study design, if renal denervation lowers blood pressure relative to sham, then in order to achieve further control, you would actually have to add less medicines to the renal denervation arm compared to the sham arm. And that's exactly what we showed.